Welcome to Quality Time, a Houston Methodist Leading Medicine podcast. I'm your host, Dr. Shlomit Schaal, a clinician scientist and a retina specialist, and I serve as the Chief Physician Executive of Houston Methodist, located in the world-renowned Texas Medical Center. I passionately believe that quality is the heart of healthcare, and a commitment to quality is essential for every healthcare system. Join us each month as we discuss the latest advancement in quality in healthcare with clinicians, researchers, physicians, industry experts, and thought leaders who are as passionate as I am. Today, I'm delighted to welcome to the podcast two of our Houston Methodist nursing leaders. Gail Vozzella is a Senior Vice President, System Chief Nurse Executive at Houston Methodist, and Chief Nursing Executive for Houston Methodist Hospital. Caroline Mascarenhas is the Vice President and Chief Nursing Officer at Houston Methodist Cypress Hospital. Welcome to you both. First, I'd like to know a little bit about you, so maybe we'll start with Gail. Tell us, how did you get to this position?
Sure. Well, I've had a long history in nursing. I've been a nurse for 40 years, so I always consider myself a nurse first, executive second, because caring for patients has always been front and center in my life. And so I have spent a long time in my early career as a staff nurse in multitude of different positions in intensive care units, in acute care units, in emergency rooms. And I enjoyed all of it. I loved taking care of patients. But early on in my career, I was identified to be a good charge nurse and then became a manager, always in the hospital environment. I loved working in a hospital. I've worked in a variety over the years, over that 40-year journey. And with that, as I became a manager, I really felt that my influence over people and what I could accomplish was more and more as I grew in that career as a leader. So I had lots of great mentors over the years in leadership, and really believe that you have to study leadership as much as you study being a good nurse. And that helped me to be very successful in my career and became a nursing director. Did quite a bit of my career in pediatrics, but then had this opportunity to shift over and become the chief nursing executive at Houston Methodist. And it was such a unique opportunity at such an amazing time in the Houston Methodist journey, as well as that I embarked on that plan. And I have been here in this role for the last 4 years.
Wonderful. And Caroline?
Well, unlike Gail, I actually grew up in my nursing and leadership here at Houston Methodist. So when I graduated nursing school and I moved to Houston from Oklahoma City, the only place that I wanted to work was Houston Methodist. And they had a graduate nurse residency program. And what intrigued me about nursing was the art and science, the blending of both. And I've always had a curious mind around why cannot we do things better or different? And I think Houston Methodist really allowed me to grow in that journey of curiosity and blending leadership along with that. Similar to Gail's path, I think that is the normal trajectory of all nurses in leadership. We start out to be excellent clinicians and very quickly get identified as leaders. And so there has been many people within Houston Methodist that have supported my leadership journey. And I spent 24 out of my 28 years here at the medical center in different roles, in leadership, in clinical roles as well. And currently, really the opportunity to blend art and science in nursing at its ultimate peak in the hospital of the future was by far the most exciting points in my career. So 28 years later, and I'm at Houston Methodist Cypress, still being curious about how can we do things differently for the patient and for our staff.
Fantastic. This is a quality time podcast. We talk about quality. And interestingly enough, I'm hearing both of you and realizing I never had a nurse as a guest here. You're my first, and then we have two of you. So if you could, any one of you, maybe Caroline can start. What is the significant role that the our nurses, play in the quality of care that we provide to our patients?
As cliche as it sounds, that Florence Nightingale, who was the pioneer of nursing, actually focused on quality as being central to the theme of caring for patients. How do you blend quality along with caring? And I think nurses do it best because of the central aspect of caring within the nursing profession, blended with how do we do things differently to make sure that patient outcomes, clinical outcomes for patients are achieved, that they are taken from illness into wellness. And that is where the journey began with Florence Nightingale, as simple as let's take patients outside and give them sunlight and get them vitamin D, to now where we are with the use of technology and real complex assessments and complex analyses of data to be able to really define what those quality outcomes are. We could talk about preventing falls for patients in hospitals. How do we do that? The journey from where we were 25 years ago, really relying on very old types of tools such as just visual monitoring, and now to introduce complex technology to prevent falls. I think this is where nurses play a very huge role, because they are spending the most amount of time out of every clinical expertise. The nurses spend the most time with the patients.
So, Gail, let's talk a little bit about falls. I know this is a big initiative in quality that you are leading in conjunction with our Chief Quality Officer, Dr. Sean Tittle, across the system. How do we do that here?
Right. So we do not want any injury to occur to a patient. And that's a variety of things. Falls is one thing. We do not want to have a patient acquire an infection, for example, while they are in our institutions either. And I think what is unique about nurses in general is that we are team players. We cannot get our work done. We can't be successful in taking care of a patient unless we work with others, physicians, physical therapists, respiratory therapists, pharmacists. So when you spoke of my partnership with Dr. Tittle, it really, again, starts early in our career that we know we have to partner. So with falls in particular, you might think, well, why would a patient ever fall in a hospital? But a lot of people come in to a hospital and they may be pretty mobile prior to entering our walls. But what patients fail to realize sometimes is that because of medications they're given or procedures that they had, or just being in a very different environment, they can fall. And so we really have to, what we work on and what we have really tried hard to hardwire is on arrival, explaining to patients why this environment is different. Because a fall could happen in an outpatient area. It can happen when getting labs drawn or in the emergency room. And our goal is 0 falls anywhere. And so we do a lot of work around, there are national bundles that are in place, in particular in inpatient areas, that help to mitigate falls the best. And that's bed alarms, that's having a fall mat that in case a patient does fall, the fall is less likely to cause a significant injury. And the amount of rounding that we do, who we give a patient sitter to if a patient is confused. And so what we have embarked on is ensuring standardization of utilization of that bundle at all of our Houston Methodist hospitals, and our nurses and our partners in physical therapy, pharmacy, that team sport of everybody understanding the why And most importantly is having a high. We have a hard time watching everybody with everything. So really using a scoring system that the patients that we're most worried about are scored the highest, and that we put special strategies in place for them. And all our partners know, gosh, this patient's at high risk as well. So those partners can help us to protect that patient.
Yes, if anything, to all our listeners, no matter what your background, falls is still a big problem in our system, but also everywhere else in the country and the world. So we never, when we wake up in the morning, we never think that we were going to fall. But in the hospital setting, people, as you mentioned correctly, have a different environment, and we really need to think about it all the time and how might we prevent it. Caroline was very enthusiastic about the hospital of the future. So what is the hospital of the future?
When we say the hospital of the future, people may imagine things that are really far beyond the reach of clinicians as well as patients. But and I echo what Roberta said very long ago, which is we're not trying to resolve all the challenges and problems within healthcare. We're taking little bits of it to alleviate some of the burdens of the staff and integrate safety and quality while we use those approaches. So what is the hospital of the future? It's actually a collection of all these little solutions that are mitigated, whether it's through enhancing processes, workflows, and incorporating technology into it. That is what we're attempting to do at Houston Methodist Cypress, which is integrate all of these together so that we can resolve small problems.
Give us an example.
Such as, one of the things that we're doing in the nursing world is to actually do an integrated model of care for the patient, where we are incorporating virtual nursing. We're incorporating technology such as wearable medical devices, which all of our hospitals actually have right now, which is the bio button, and also upskilling all of our staff so that every staff can perform at their highest level. We're also utilizing patient communication technologies, which there again allow for the nurse to spend more time with the patient rather than having to run in and out of the room multiple times, trying to get that information exchanged between the patient and the care team. So there's multiple different technologies that we've incorporated in here we've only been open for 120 days, and we're already getting feedback from patients as well as from staff that these solutions are helping. They are helping with lessening the documentation time. They are helping with more defined communication to the patients and family members. They are helping with coordination of care, response time. It's a little too early right now for us to say, is it all impacting quality outcomes? But so far, I can tell you, we've had 0 infections. We've had a few falls, but there's not been injuries with falls. We've seen patients being very satisfied with the communication that they're getting in real time because they could use their digital platforms to be able to be informed of when is my next medication due, who is my care team. That, as basic as that sounds, that is a frustrating communication gap with most of our patients, not knowing who the doctor is and who the nurse is.
So let's put it apart a little bit. Gail, what is virtual nursing for those of us who may not know?
Sure. So we have, first and foremost, here at Houston Methodist, the virtual nurses are Houston Methodist nurses, which I think really matters. So they are nurses that we either hired externally and trained, or that they have come here and have been bedside nurses and have moved to that virtual environment, which means they share our culture, they share our values, they understand that we put patients first here at Houston Methodist, and they're part of our care team. So initially, virtual nursing started during COVID, and it was virtual ICU nursing. And we all know COVID in the intensive care units was really challenging to care for patients, limiting caregivers going into that room. So virtual started then and was very successful that we continued post-COVID in supporting nurses in giving care. But it looks very unique in the ICU. They look at a lot of data to help nurses know if a patient's deteriorating or not. And they'll help if a nurse needs to take a break. Instead of another nurse watching 4 patients, they'll zoom into the room and help to monitor patients. But we knew we needed more than just virtual ICU nursing to unburden the work of bedside nurses. It had to go beyond the ICU. And we also knew that acute care nurses have the lowest satisfaction rate nationally. And so if we are going to continue to have nurses want to work in acute care because we need them, it's a very important time in a patient's journey. There's a lot of care coordination, ready for discharge, education that occurs in acute care, that we need to make sure that nurses feel that they have the right support around them. And 40% of the time in acute care is spent on documentation nationally, and we are no different. We did a study here. It was exactly the same. Large amount of a nurse's time on documentation, which we want in our electronic medical record, that documentation, but a nurse does not go to school to type. All nurses really go to care for patients, not to type. So we started...
Same with physicians, by the way.
Yes, exactly. And you may say some physicians, you have forms of, that they can do dictation. And why isn't that okay for nurses? But we use a lot of different flow sheets. And no technology is sophisticated enough to populate what we need to populate on different flow sheets. So they type. And so what we did was we took admission and discharge information that we need from patients, and we moved that to virtual nursing to come in. Now it's through computer screens, but at first it was on iPads as we piloted it. And they do all of the typing for the patient on admission. For example, why are you here? What are your medications? What are your allergies?
So this is done everywhere at the Houston Methodist?
Everywhere. Now, Caroline needs to talk about how she took that virtual nursing in acute care to a different level to even better support the bedside nurses.
So Caroline, please.
Yes. So Gail's right that through our system, we use virtual nurses. So it was great that we already had a platform to build upon. So at Cypress, what we did was take the virtual nurses and really integrate them into the everyday workflow of the bedside nurse, such things as participating in multidisciplinary rounds along with a physician. This is real. And it goes one step extra, that we are able to then loop in family members that are not present physically. We can connect them to the platform so that they are present in real time with the physician rounding with the bedside nurse. And then these virtual nurses are doing the documentation as well and coordinating the care. That has really taken a heavy burden off the bedside nurse. So incorporating these virtual nurses to do more than just documentation, but participation in care coordination, developing goals with the patients, having a shared responsibility for the outcomes of those patients has really transformed how virtual nursing is being done at Cypress.
So if I am a virtual nurse, I'm only a virtual nurse? Or
no,
am I also...
and that is where it's unique in Cypress, that this really allows for now nurse satisfaction because they can do a shift in virtual nursing and a shift at the bedside. So they're really integrated into the team. As Gail had started off by saying that these virtual nurses share our values and our culture, at Cypress, we've taken it one step beyond, that they even share within the staffing model. They know each other. So it's not a random nurse that pops up on the screen that they have no relationship with.
So the care team is the nurse, the acute care nurse at the bedside,
and the
virtual nurse, and then the physician,
and the nursing assistant,
and then the patient,
yes,
and their family.
Yes.
Amazing. Okay, that sounds really like a hospital of the future. Fantastic. I want to skip to another thing that you mentioned is the wearables. Gail, what are wearables?
So there are devices that, sometimes patients have, a lot of people have Apple Watches, for example, wearable that track, you can get your heart rate. But these are, of course, more sophisticated devices that we place on patients. And what it tracks is that resting heart rate and respiratory rate on a patient in acute care, which is different than a telemetry. It's different than being in an ICU on a monitor. And what's different about it and why it's so impactful in acute care is typically in acute care, we do a full set of vital signs, meaning heart rate, respiratory rate, temperature, blood pressure, every 4 hours on our patients. And so we have spots in time to check that information. But as we all know, a lot can happen in 4 hours to a patient. They can become more dehydrated, or they can get better too. It's the whole gamut. And our nurses in acute care have 5 patients on average. And so having those spot checks are important, but there's gaps in between. And what the wearable does is it looks at trended data, and particularly at heart rate and respiratory rate. So it's the median average every hour of heart rate and respiratory rate, which we know are early indications if a patient's deteriorating. Your heart rate will change and your respiratory rate will change. And what is fabulous about this wearable is it will alarm based on algorithms if a patient is going in the wrong direction. So for example, if your respiratory rate is going down and your heart rate is going up based on algorithms, it alarms. Our nurses at the bedside have a ton of alarms. So if we give them one more alarm, then it's just another distraction for them providing that care, because this is a new device. Some alarms are accurate, some are not. It is pretty darn accurate, but still, we wanted somebody else to take a look at that as well. So it alarms in virtual. The virtual nurse then goes into that patient's chart and can see, okay, look at, this patient just came out of surgery. It looks like his respiratory rate is going down. I'm going to call that bedside nurse and alert him or her that I would like you to go in and check on that patient. So what does that mean for our nurses? Number one, they have a great wingman that's saying to them, hey, that patient, they may have been tied up with another patient and not noticed. And so they can go in and check and assess the patient, call the physician if need be. They can also catch things earlier because now we have every hour data. It's not every 4 hours. So that trending allows us to catch things earlier of deterioration, which means we can intervene earlier, which means less patients go back to intensive care units, and we keep them in acute care, keeping them on that journey to health and not back and forth. So it really works incredibly well to help our nurses, but also to help our patients. And eventually, as it will have blood pressure as part of that reading, which will be another huge help, temperature, another reading that will help us to have all components.
It doesn't have a temperature now?
No, we're studying it. So it's not, we're testing accuracy, of course, first.
And this is for every patient everywhere in the Houston Methodist system.
So we have all that data.
How unique is it in the country? It's
very unique. Okay. Yes. And eventually, wouldn't it be great is instead of keeping a patient 2 more days because we're a little bit worried about him or her, is that we can say well, let's send them home with that wearable and we can track them at home and let them get back to their home environment, right? Where they feel better in general and we can free up to serve more patients. Yeah. And so it's not, the great thing about here, as Caroline mentioned, with innovation as part of our nursing care, we don't stop at, okay, we've done this, so look at us. Isn't this great? No. What else? How can we help? And along the way, getting direct feedback from physicians. As we implemented that wearable, that was done in alignment with all of our physicians, all of our chairs, that they understood how that developed, and they were comfortable with us putting those on our patients and advocated and helped partner with us, of course. And then getting feedback from patients. If you have less interruptions, because now that we have that trended data, we moved vital signs full sets from, in general, routine vital signs from every 4 hours to every 8. So can you imagine not getting interrupted as much when you're trying to sleep in a hospital at night? And if a patient rests more, they recover more.
Absolutely.
And so it's really great for our patients. It's great for our nurses. And finally, it does our patient care assistants that help support nurses. They spent a lot of time doing those vital signs around our unit. And by unburdening that group, they're able to ambulate patients, help us do CHG baths, help, again, take tasks away from nurses to allow nurses to critically think, help care coordinate. So it really has been incredibly successful.
Wonderful. Back to Caroline she mentioned virtual nursing and she mentioned wearable, but another thing she mentioned is communication.
Yes.
And kind of the communication of the future. What does that look like in Cypress?
So Dr. Schaal, you know that whenever we assess any type of failure, there's an element of a communication gap that is recognized and identified as contributing to that failure. And we are continually, to Gail's point, evolving in terms of how can we do this better around communicating. There's always fragmented communication between physicians and nurses and the care team and the case manager, and largely the patient is unaware of anything that we're talking about. So at Houston Methodist, we already have iPhones in many of our areas. iPhones is a very solution-based tool so that it integrates different platforms to allow for real-time communication. So all our clinicians at Cypress, nurses and nursing assistants, all have iPhones. And what does the iPhone do?
This is different than the personal phone.
Yes, these are work-issued phones.
Okay.
They are shared devices, meaning they hand off from one shift to the next shift. And data is erased after every shift. And what it does for the bedside clinician is it's a one-stop shop access for everything that they would need. Access to information, which is the electronic health record. They can see Epic information in there so that they could quickly respond to the patient. They can quickly look at labs to be able to coordinate care for the patient. They can barcode medications at the same time. So this device not only allows them to retrieve data, look at data, analyze data, it also contributes to patient safety by being able to barcode medications. And then the best part of this is real-time communication. The nurse doesn't have to leave the room to come out and find a communication device. Now within their iPhone, they can secure chat. Any number of members within the care team in real time and get a real-time response as well.
So who has these iPhone? Who carries them?
All the nurses and all the nursing assistants and any clinician, physicians who are in-house as well, all our hospitalists, all of them have the iPhones so that in real time, and the virtual nurses are also looped into this communication. Amazing. So they create groups that they can communicate with. They can create groups that are tiered, meaning for emergency responses as well. So the iPhone is this universal tool that nurses now can really, we've gone away from multiple devices that nurses had to carry. They would carry Cisco phones and pagers and badges, and now it's all into one platform. We have this software called Vozzella Edge, which again allows for cloud-based communication in real time. And all that data is erased after one shift, and then the next...
Who erases it?
It automatically erases it once the clinician clocks themselves out. So you log yourself in and you log yourself out, and it's interfaced with Epic. So whatever your assignment is in Epic, you get all your patients populated into your iPhone so that you don't have to create a patient list as well. So you can just go into every patient's room, pull up information, barcode them, give them their medications, barcode for labs, and in real time, communicate.
Fantastic.
You can also take pictures because we're doing it at Cypress, for wound care with your iPhone, which is then downloadable into the electronic health record.
So, I'm sitting here listening to both of you, and it dawns on me that nursing is different than in Houston Methodist, in Cypress, but also everywhere in our system, than it might be anywhere else. So what have you seen in new nurses that come to the system, maybe from nursing school or maybe from other systems? What do they say to you, and how do you make sure that they know how to use all this technology?
Right. And I think just to call out Caroline and her team, starting a brand new hospital, nurses, and I think Dr. Schaal physicians may be the same, is when we have a new piece of technology, we're trained initially, but we understand probably a quarter of how to use everything about that. And nurses are notorious for that, because so many training things have to happen. And so what Caroline did an amazing job with her team is they did intensive training. So as she explained with the technology to communicate, the iPhones, is the nurses know how to use all of it. And I think that intentional training is key as we move forward. As technology becomes more and more important in our work, is nurses have to not just train once, and especially if you're a new nurse. So if you're a new nurse, that transition to practice is huge, just probably the same for physicians. And so you train before you arrive on a unit. And in prior years, in our 40-year, Caroline, my long career, is you would have annual training, and that was it. Well, the world moves fast now, so we have moved here at Houston Methodist to quarterly training for most significant things, including communication devices, because we want you to build on that knowledge. You can't learn everything the first time, but if you do it over and over again, you're going to keep learning, and it'll keep supporting you. And why that's important to new nurses as well as anybody who's entering Houston Methodist as a nurse is we want to be prepared not just for today for nursing, but we know that there's a shortage of nurses to come. We also know that nursing has a high burnout rate, and we hear the voices of our nurses. So one nurse said to me, she had been an engineer before she was a nurse, and I said, well, what do you think about being a nurse? And she said, I didn't know I was going to have to be an operator. I spend half of my day calling people. And I thought, well, that's wrong. Why does she's picking up the phone and calling. So as you try to create a better environment for her and our other nurses, it's like, well, how can we mitigate those phone calls? Well, we know texting is easier. It's more direct. You can see if somebody's responding. You're not leaving a message for an answering service. It's better. It's better for our nurses, better for our patients, better for our doctors. So we have to make sure that everybody's educated on how to do it. And we've actually we did an open house with all of the deans of schools of nursing around Houston Methodist to show them our technology, because our goal is that we back some of that training up before you ever hit our doors, not just in clinical activities that you have in our hospital, but that actually in their simulation centers, they have our technology. Because if you can make that transition to practice easier, a nurse is going to be more comfortable. If you can keep a nurse a year, you have a much higher likelihood that they'll stay 3 years, 5 years, have a career here. So that's our goal.
And I'd like to add to what Gail said was that at Cypress, we also had the opportunity to reevaluate workflows, because every time you introduce technology or you introduce a new step, you have to redesign that workflow. So what we did was actually have a group of nurses to tell us what's going to look different when they have to use the technology. So for example, the digital whiteboards that we reference in Cypress, which is an infotainment system. It's a large screen TV that the patient can use for accessing clinical information as well as just watching TV. as nurses, we have been trained to walk into a patient's room and write something on a whiteboard. You write our names and write the goals, and that does not occur at Cypress. So it's a transition from a workflow, a traditional workflow, to now a new workflow. So we had to Gail's point, the training had to include the new workflow. And how would you address that? And so that was the focus of the training, was not just how do you use the technology, but how are you going to change your entire way of presenting into the room?
Fantastic. So this is all sounds fantastic, and we can talk all day, but getting to the last question, and the last question is the same question that I ask every single guest of mine in this show. And the question is, what does quality mean to you? Caroline.
While quality has a lot of measures and metrics, to me, really, I take it one step further. It is the feeling as well. Yes, we measure patient experience, but quality includes what is the staff experience as well, to the workflow, to the processes, to those outcome measures, involving both the nurses and the patients in defining what quality is for each one is how I look at quality.
I think that's fabulous, Caroline. I would just add is our quality means getting that patient to the best state of health, in that our care teams are surrounded by everything they need, the right team, the right equipment, the right technology, everything they need in order to provide that care to that patient to get them to the best state of health they can be in.
Yeah, so I love that the quality is a feeling. I think, I ask these questions and every time I get a different response, and it's fascinating, but it's the feeling. It's not only the metrics that we know, but also a feeling that you're in a place of unparalleled quality of care. And thank you, both of you, for being my guest today. And thank you for what you do for our patients and for your leadership. I really applaud you.
It has been a pleasure. Thank you.
Thank you.
And thank you for listening. Quality Time is part of Houston Methodist Leading Medicine series of physician-led podcasts. So that you never miss an episode, subscribe to Quality Time. New episodes will download to your podcast device. If you enjoyed our conversation today, please consider rating this episode and sharing it with your colleagues. I appreciate your support. Thank you, and until next time, I am always listening.